Welcome to Krishna IVF channel, a channel that is provided as an education service by Krishna IVF Clinic. Today we are discussing about the world of embryo freezing, a technique that brought in a lot of hope and improvement of pregnancies. In this video, I'll be discussing what happens during embryo transfer and what happens during embryo freezing. When you look at the major advances that happened in reproductive medicine in the last 100 years, one of them were the advent of IVF in 1978, the use of ICSI, testicular sperm extraction, that means the role of IVF being useful in male factor in late 90s. Then with the advent of vitrification technology in early 2000s, have changed the field of reproductive medicine to a large extent. And I'll share you some of the details. We at Krishna IVF, along with the team of Krishna IVF, had made significant contribution to field of embryo freezing, and we have published an article on reproductive medicine online in 2005 on the role of vitrification of 8-cell embryo using a modified ethylene glycol based protocol. This procedure has significantly improved the procedure, and this work has led to higher implantation pregnancy and also better results. And we are proud to say that we are able to share our knowledge of this across the country and across internationally by allowing other clinics to come and watch the procedures, because we feel sharing our knowledge and the best practices help an unknown woman, and that is what we believe in. So, in embryo freezing, also known as cryopreservation, is a process where embryos that are created by IVF or ICSI, that temperature is brought down to sub-zero temperatures, and then they are stored in liquid nitrogen, and the exact temperature that is stored is at -197, where life becomes in a sustained state and they are freezed. Why is embryo freezing important? It offers number of benefits to patients undergoing treatment. It allows couple to save extra embryos from a cycle, reducing the need of costly and multiple procedures. When there is a need for pre-implantation genetic diagnosis, once the genetic material is sent from the embryo can be frozen. Once the report comes in, then that frozen embryo can be transferred back into the uterus. The other thing is it allows flexibility for the couple for personal, medical or financial reasons that they want to delay a pregnancy where freezing technology is used, be it oocyte freezing, embryo freezing, sperm freezing. But mostly people delay pregnancy in that group of people. Oocytes and sperms are frozen. In certain cancer patients, oocyte freezing and sperm freezing is done to preserve the fertility before they undergo the chemotherapy, which will destroy the genetic material. The success rates of frozen embryos have steadily increased thanks to the advance of technology like vitrification, and we are happy we have 3 publications in that area of vitrification, and we feel proud that we shared this knowledge. Finally, in conclusion, embryo freezing is a process where the embryos are stored at -degree using liquid nitrogen, and the temperature at which they are frozen are -197 degrees centigrade. There are essentially 2 procedures to do the embryo freezing: slow freezing, which was practiced widely up to 2005, then vitrification, which came in from 2005, and now most of the clinics around the world practice vitrification. Hope you enjoyed the video. Please let us know in the comments below and subscribe to our video. Thank you. Have a wonderful day.